Okay, so I'm super, super excited to introduce you guys to Jatem. I love her so much, and I am so grateful that I met her. We barely met in February, and we probably interacted twice in our life in person, and then we decided to do this thing. And so I'm so glad I met her, and that I'm just going to start crying again because I am like good on that. But I'm just going to read her intro that she wrote herself so I don't cry, because I just think the world of her right now, and always. So, breastfeeding while postpartum. So today Jatem will be speaking on what women go through both mentally and physically while she herself is breastfeeding and postpartum. We believe that women deserve more education and resources to learn this new skill and have the support you deserve throughout your breastfeeding journey. Jatem will be covering situations that moms go through with bottle and breastfed babies, pumping and some breastfeeding tips, and honestly so much more. I have 2 kids, and my breastfeeding journey was very different between the two. My first one I breastfed for 2 years. My second one for 2 months. Because things were different. He had reflux, I thought something was wrong with my milk, and it was just a lot going on. And so I experienced both spectrums of how long you breastfeed, and I wish I had a Jatem in my life, because by the time I met her, my baby was like 9 months, 10 months, and my milk had dried. She's like, oh, it was because of this, or you've done this, or like, it never made me feel guilty about it. It just like, I just wish, like, even though I breastfed for 2 years, there was like so much I didn't know. And every day I continue to learn so much about breastfeeding, even though I'm not pregnant or expecting to be pregnant. And so she is a wealth of knowledge. She is a breastfeeding guru, and just take it away, Jatem.
Thank you for that. Okay, well, my name is Jatem. I am a registered nurse, a certified lactation educator, a mother to 2 girls, and I'm also a birth doula. So, and I'm here with the Postpartum Revolution. My why for becoming a certified lactation educator is because I feel like there's not enough resources and assistance with breastfeeding, and so I wanted to help out with that. In this segment, I'm going to take my earring off, guys, because it keeps bumping this, so I'm hearing this on one side. My segment today is called Breastfeeding While Postpartum, because I think there's so much that goes under postpartum that we're not covering, which is the healing and the mental aspect that we did as well today, but there's also breastfeeding, and every woman lactates after birth, whether you breastfeed or not, and it's just undereducated in my opinion. So there's a whole process going on here with your breasts while you're postpartum, and I'm going to explain that today. A quick overview, we're going to be going over how your milk comes in when you're pregnant and how it matures to mature milk, how your baby has growth spurts and what that means, introducing solids, pumping, weaning, and much more. These are areas where I've struggled with. I've breastfed 2 babies now, and it's never been easy until I decided to get this certification and learn everything about it. So I really like to dive into what's going on with the mother as well, so that you guys can know more about your body and what's going on. So go ahead and follow in your workbooks. I've made it really detailed to match exactly what I go over. You'll have areas to fill in. Make sure you're turning the page so that you can follow along, and let's get started. So there is all sorts of ways to feed your baby. This is a picture of moms feeding their babies with tube feeding, bottles, their breasts, donor milk. It doesn't really matter how you feed your baby as long as they're thriving, healthy, and gaining weight, and that they're happy and you're happy. And I truly believe that, and I want every woman in this room to know that. I went into, lactation educating to assist women because I believe that breastfeeding is a very natural process. It's not easy at all, and there's need for more education. So, with that being said, you guys are doing an amazing job as a mom, no matter how you feed. Okay, so I'm talking about pregnancy here because I want to explain an important thing that takes place when you're 10 to 14 weeks pregnant, and that is that your colostrum comes in at this time. I like to tell people this because colostrum is breast milk, and it's like the best breast milk. It's why your breast milk is called liquid gold, because it is just jam-packed with several things. We're going to go over in next slide everything that's in your colostrum, but you have milk when your baby is born. And a lot of women don't think this. They think that they need to have a couple days before the milk increases in volume. And you do, but there's a process that's taking place, and you've got milk when your baby is born. It's colostrum, and it's the best milk for your baby. So at 10 to 14 weeks, this happens, and then birth happens, and colostrum is what you're feeding your baby. So here we're going to explain more on colostrum from early birth to 3 to 5 days old. There's a long list on your books of all the amazing things that colostrum provides your baby. Some of my favorite to touch on is that it is jam-packed with antibodies, and it coats your baby's sterile stomach when they're first born. So your babies come out and they've never been introduced to any bacteria, viruses, any food at all. And this helps them with that. It coats their stomach so that those bacteria and viruses cannot enter. So it coats the stomach and it protects from illnesses and diseases for a lifetime. So colostrum is amazing. It's why you hear that breast milk helps with diabetes and cardiovascular disease and such like that. And it provides a laxative effect so that your baby compacts their meconium, which is stool, and then decrease jaundice risks. So what I want to just reiterate here is that colostrum serves as the perfect food for your baby, and it may be low in volume, but it's very high in nutrients and everything your baby needs for that first birth to 3 to 5 days. And then in your guys' workbook, I have a question here for you. It's in the second box next to colostrum. It says, what changes at or after birth to start milk production? Does anybody know, lactation consultant, you're not allowed. Does anybody know the answer to one of these? What changes? What happens after birth? I'm happy you don't know because that's why I'm here today. You lose your placenta, and that stimulates a hormone in your body to make milk. And I like to say this because a lot of women think if they have a C-section or if they're not having a birth, like a vaginal birth, that their milk will take longer. And that's not necessarily true. As long as your placenta leaves the body, your milk will start to produce. The other way is that your baby comes on and sucks. So these are the two ways. I honestly went through breastfeeding 2 kids and didn't really click that if my baby wasn't sucking, like we milk a cow, milk's not gonna come in. So it's really important to know this, like the process has to keep going. You've got to keep breastfeeding to continue to have milk. And then I just love this saying that the most amount of breast milk that you can give your baby is the best amount. And that really goes into knowing that the 3 to 5 days does so much of that colostrum. And some women want to breastfeed and they make it to this point, and that's amazing too. So there's that. And now I want to talk, so we talked about colostrum, and now I want to talk about what's going on for mom and baby at this point. So you're after birth, and you're about 3 to 5 days postpartum. Mom and infant are making a transition. I feel like a lot of people don't really think much about this, but you went from feeding your baby inside to now feeding them outside. You grew that baby for 9 months, and now there's a process to start feeding them outside, and that has to be a transition that takes place, and it takes time. And same for baby, they're usually getting, at this point, the nutrients from your umbilical cord, but now they need to learn how to breastfeed. So there's that transition going on. Supply will be low in volume at this point, but high in nutrients with that colostrum and the perfect amount for your baby. Comfort for mom during recovery. A lot of moms struggle to find comfort because they've just had a birth, whether C-section or vaginally. So making sure you're using pillows to keep you comfortable, however that may be. You're going to have that uterine cramping because oxytocin is here, and it pushed the baby out with the uterine cramping, and now it's going to continue to push out clots and everything else you need to move, through the last stages of birth. And it's uncomfortable. So my favorite tip with this is to use a heating pad. I didn't know this until second baby, and it was like a life changer for me. It sounds simple, but it's really, really helpful. And then your baby is born with a job at this point, and that is to suck, to tell your body and communicate with your body how much milk you need to make. This way, the mother can now start the milk machine. If there's not that continuous communication with your baby coming on to tell your body how much they need, they program your body with how much they need, then milk supply will stop. Okay, in your book I have baby needs day 1 through 3, and this is going to show how much food your baby needs first 3 days. So day 1 is about 5 mLs, which is the size of a quarter, per feed. So every time you feed day 1, they need the size of a quarter in liquid. Day 2 is 10 to 15 mLs, so 2 to 3 quarters. And day 3, there's an error or typo in your guys' book, so please fix this right now because I am going crazy about it. It's 0.7 to 1 ounce, not 10 ounces, guys. We don't need to feed the baby 10 ounces on day 3. So change that, mark the 0, it's 1. And again, if you've seen a bottle, 1 ounce is this much, right? So again, day 3, not that much. Baby's learning how to latch at this point. There's a learning curve with that. Oxytocin and prolactin are starting to produce. Oxytocin is the feel-good hormone that stimulates the letdown, and prolactin continues to tell your body to make more milk every time your baby sucks as well. Hand expression should be started at this point. It said that if you can use hand expression in the first few days, it will ensure a good milk supply throughout the rest of your breastfeeding experience. And then mother may feel discouraged at this point. And I like to talk about this because it is rough those first few days, and it's okay. And there's help, there's resources, but there's stuff going on here that it's important to know, and you're doing the best you can, so keep it up. And I just like to show this to reiterate how much milk your baby needs. The spoonful is day 1 per feeding. The second day is the 2 spoonfuls per feeding. And then showing you how much milk, how big your baby's stomach is on day 1, 3, and even a month old, it's the size of an egg. Okay, pop quiz on the bottom of your guys' first page. I have a fill in the blank on how much your baby needs day 1, 2, and 3. Who wants to tell me day 1? How much your baby needs per feed?
5 milligrams.
5 mLs. Okay, how about day 2? 10 to 15. And day 3, please get this right because...
0.7 to
No, not 10. 0.7 to 1 ounce, right? Okay. And then on the other side, there's another box that asks you some questions. How big is your baby's stomach? Does anybody know how to tell how big our stomach size is? Our fist. So that's mine too. So I have to think about that sometimes when I want in and out. Okay? And same when your baby is a brand new baby and their fist is like so itty bitty. That's how much milk they need. Baby's job when they're first born is to suck, okay? To milk the mama. Oh, I'm not ready yet. Milk production hormone, which one is that? The one that makes the milk, that starts the milk, prolactin. And the feel-good and let-down hormone, which one is that? Oxytocin. And why do we have less milk in the first few days? So number 1, if you had an abundant amount of milk day 1, would your baby be able to handle that the first day out of the womb? No. They would choke on the oversupply. It would be really hard for them to feed. So there's a process being taken here, and it's really 1, that your baby can't handle it, 2, that they need to come and communicate with you to tell you how much they need, and 3, that this transition from womb to earth is taking place. Latch. Let's talk about latch, ladies. In your book, there is, I'm going to take these over here. There's a really good definition if you turn the page on latch. And a proper one, and it says a proper latch is when your baby opens their mouth wide and takes in not only your nipple, but also as much of your areola as possible. A deep latch protects you from getting sore nipples, protects your milk supply, and allows your baby to transfer milk. And then I have components of a deep latch on here that really go with the picture I have on here. The lips are curled out, the chin is against the breast, nose airway is clear, your baby's mouth is covering most of the areola. So this is what you want to achieve when you're trying to get that proper latch. And then I always teach laid back nursing because, as I don't know really why, but with both of my kids, I thought that I needed to kind of bend over and feed them. And if you think about laying down on your back and trying to like latch up onto anything, an apple or a breast, it's hard. So laying back and letting your baby lay on you skin to skin and putting them on you will create a better opportunity for you to get the proper latch. Ridging your breast or breast sandwich or taco. A lot of women, no matter how they breastfeed or no matter the position of their baby, they will ridge their breast from the side to try and sandwich it in their mouth. But this can be defective if your baby's mouth doesn't line up with your breast. So I've done this many a times too, where I'll cross cradle my baby and sandwich my breast, and I'm trying to feed them a sandwich like this, okay, or a taco. Don't do that to your baby. So what you can do is come underneath and sandwich underneath so that it's making the vertical line to meet your baby's vertical mouth. Does this make sense? And if you do a football hold, that would be the proper side sandwich, okay? Feeding cues. There are several feeding cues, and the reason I talk about this is because it's very important to watch your baby for feeding cues so that they're not completely fussing and screaming by the time you go to latch them. Now, this happens all the time, but it helps with latch if you can catch the feeding cues before you put them on, because they're just wailing and they're not going to latch properly. So feeding cues such as lip and tongue movement, hand to mouth, stretching or turning head to chest, and rooting. And then there's a way to check latch. If you have your baby on you and you roll them about an inch away from you and they stay on, they like bring your boob with you or with them, this will mean they're latched. If they come off an inch away from you, they're not latched. So you can keep trying to create that proper latch by putting them back on. And one of the most common things we'll do as moms is not fix the latch and create sore nipples and a hard time like breastfeeding because your baby's not getting that latch, which means they're not going to gain weight, and so on and so forth. So what you can do is you can stick your finger in the corner of their mouth and unlatch, and then get them back onto a proper latch. So if you know your baby's got an improper latch, fix it. A good way to know if that's happening is if your breastfeeding session is hurting the entire time, that's a latch problem. If it hurts for the first couple of minutes, that can be just a sensitivity problem to your nipples learning this new skill. Okay, so we talked about colostrum. Now we're talking about transitional milk. Your milk is moving from colostrum to your mature milk that will stay that way for the rest of your breastfeeding duration. What's going on at this time is mom is going to have some sore nipples. Engorgement. Sore nipples occur when you have an improper latch. Sensitivity nipples is normal. It doesn't mean that latch is improper, but it can. Breastfeeding shouldn't hurt. More so sensitive. Engorgement is in congestion of milk that comes when your milk increases in supply on these days. And then you're going to have that increased supply, you're going to be getting settled at home. And then I think it's really important for everybody to know that from birth until about 2 months, you should be feeding your baby 10 times in a 24-hour period. And then I just put down here, the more often you feed your baby, the more milk your breasts will make. And then we have some sore nipple management and engorgement management. We'll start with sore nipple management. Make sure your baby's got that deep latch. Laid back nursing. These are some things you can do to help with this. Make sure your baby is opening their mouth really wide so they can get a mouthful of breast, is what they call it. Is latch causing this? We talked about how you can tell if the duration of your session feeding hurts the whole time. It's a latch issue most likely. I always suggest that if you continue to have pain with latch, always reach out to a lactation consultant. Sensitivity can be normal for about 14 days. Anything beyond that needs some assistance. We've got one here with us today. She's in the back and she's got a perfect ad in the book for you guys. Position changing can help create a proper latch. can help with sore nipple management. And then lanolin, coconut oil, and wet wound healing. These are things, a lot of people think that lanolin is going to like come on and magically like help your boobs. So what we're trying to do is keep the breasts moist or the nipples moist so that they don't crack and scab. With our skin, we do need stuff to scab to heal, but that's not how nipple tissue works. If you crack and scab your nipples, it will take a lot longer for them to heal. So use these things to keep your nipples moist, and then the wet wound healing is taking a breast pad and getting it wet with your breast milk, and this way it moistens, and your breast milk is full of antibacterials, antifungals, and antivirals. So it's like medicine that you can use to help your nipples heal as well. And then the hydrogel pads also keep moist, cool, and the nipples from getting sore and cracking. So that can be helpful. Managing engorgement, feed on demand, gentle circular massage on your breasts, warm shower compress, hand expression, supportive bra, and cabbage leaves for the cold compress, but do not use cabbage leaves for an extended period of time because it will actually decrease milk. Okay, now we're moving on to the mature milk. So at this point, milk is still meeting all of your baby's needs until about 6 to 8 months with health benefits that last a lifetime. And the longer you breastfeed your baby, the greater the health benefits. At this point, mom is going to start working on establishing breastfeeding. Usually take 4 to 6 weeks. You're going to be introducing pacifiers in bottles at about 4 to 6 weeks as well. Oversupply starts, engorgement should be getting better, and so should sore nipples. So this is 14 days and beyond throughout the rest of your duration of breastfeeding. So go ahead and turn the page with me. And now we're going to talk more about the rest of your postpartum experience while breastfeeding. Women often will ask themselves if I'm making enough milk. Am I making enough milk? Is my baby satisfied? And I like to go over when you'll feel this way so that you can know when you're here. Those first few days when the milk volume is low, but it's the good colostrum, when your baby is going through a growth spurt, teething, cluster feeds, sick and fussy, and during that witching hour from like 10 to 2 a.m. when your babies decide you don't deserve sleep, you'll wonder, and you'll be like, is it milk? I think something that's really important to know is your baby misses
Those first
few days. So give yourself and your baby some time to get adjusted to this new transition of birth. And then ways to know if breastfeeding is going well. I have a whole list for you guys just so you can see like is this how it's supposed to be working. But the most important things is weight gain for your baby, audible swallowing so you can hear your baby swallow, and that they're having an adequate amount of stools and wet diapers. And then I have down on this list that breastfeeding is making you happy, but what if breastfeeding doesn't make you happy? Is that okay? Very much so it is. We're not all the same, and we don't have to all enjoy breastfeeding. And I just think it's important to know that if you're not enjoying it, that's okay. And you can do something different, and your baby will thrive and be happy. And then down here I have something that says, early supplementation with formula is the key predator of not achieving breastfeeding goals. Every time you supplement with formula, you miss out on the opportunity to keep making the milk machine. So if you are wanting to continue breastfeeding and you're supplementing, which sometimes is very necessary if your milk isn't increasing in volume by that day 3 to 5, make sure you're working with a lactation consultant if this is going on. But it is important to know that formula feeding will discontinue breastfeeding if it's continued and more frequently. Okay, now we're going to talk a little bit about what your milk does throughout the day and what your baby's needing. So in the morning, you sleep all night and your breasts fill with water, so you're going to have a lot of volume but low calories. And this is because the volume dilutes the calories. And your babies really like this because it's just like an abundant amount of milk, but it's not the calorie milk they need. So a lot of women will wake up and pump in the morning. And I think it's important to know that pumping in the morning is great, but you're gonna have lower caloric milk, so pump throughout the day too. Or pump at night and then in the morning, or just, change it up. In the evening, you're gonna have less volume because your baby's drank it all and you haven't been sleeping all night to fill those breasts with water, but you're gonna have that really good high caloric milk that your baby needs to sleep throughout the night and to boost up. It's gonna help with growth spurts, cluster beads, all that kind of stuff. And then at night, who wants to sleep through the night? Everyone, right? But there's a process going on here at night, and it's that your babies actually gain the most amount of weight because by drinking at night, because they'll consume the most amount of milk at night. So it's really good for weight gain, and then also your prolactin levels that increase that milk is highest at night. Oh, I wanted to give you guys a tip because breastfeeding at night is so rough. My 11-month-old is still breastfeeding like 3 to 4 times a night. I don't know what's going on. I just wake up and smile and realize that she won't be my baby forever, and it just really helps me feel like, okay, I can do this. I can wake up for the 4th time, and I won't have this baby forever. So putting on that smile even when you don't feel like it. And this goes for all babies. Breastfed or formula fed, they all want to bulk up in the middle of the night. Establishing breastfeeding. What does this mean? There's a good explanation with a proper latch suction. This is in your book. Good milk supply. You're getting comfortable with positions and you're connecting with your baby, and they are thriving. This happens at about 4 to 6 weeks, and this is when the AAP, the American Academy of Pediatrics, suggests initiating pumping, pacifiers, and bottles. So there's a process that they don't want to disrupt, and it's the sucking process that your baby needs to continue to tell your breast to make milk. With that being said, a lot of moms end up needing to use binkies and such to soothe their baby sooner, and I think mother intuition is just as strong as this recommendation personally. So listen to your mother intuition and what your baby needs. And then the wonderful process of a baby preferring a breast over a bottle and not being able to get your baby to drink a bottle. This happens because they want to drink on their mom. This is what they're used to. Something that you can do to help with this is starting to bottle feed sooner. When your breast milk or your breastfeeding is established at that 4 to 6 weeks, and you can give a bottle 2 to 3 times a week to help with that, and continue that so that you can have girls' nights and days out. And I'm looking at my best friend right now because she doesn't ever get out. So you deserve it. Every mom deserves to get out, and this will help give your baby a bottle when you do. And then consistency, trying different bottles. Guys, something I failed to mention is my baby is 11 months old and just barely took her first bottle for a week ago, so I need a clap for that because I needed that as a mom. I felt for 11 months that I couldn't be gone for more than 4 hours from my baby. And I love her and I want to be with her every hour, but I also love myself enough to know that I need me time. And that's really important. It's something I didn't know when I was a first-time mom or didn't value. So you can try different positions and have your husband or partner feed them. You can give them dessert bottles. So go ahead and breastfeed them, and then in about 20 minutes give them a bottle to let them experiment and play with the bottle, and then it's also like a little dessert. Make sure the milk is warm, and then don't force it. No baby likes to be forced on anything, they'll tell you. And then bottle over breast. This happens as well. Why does it happen? Because a bottle is actually really easy to drink once the baby takes it. It's like this continuous flow of milk, and they don't want to have to stimulate the letdown on moms, and so babies actually will want to bottle feed over breastfeeding. And I've had this happen with my first. We had to do some formula and a few other things because she had really bad acid reflux, and I didn't get her back to full breastfeeding until 4 months old. What it took for me was pace feeding. Go ahead and look this up if you are going to bottle feed, because it basically mimics what your breast will do, and that way they don't get used to bottle feeding, the consistent or the continuous flow of bottle feeding. Patience, and again, mom will feel a little rejected at this point. Why is my baby not taking my breast, and why would they rather have a bottle? And this is totally okay to feel this way, and I just think it's important to accept it and talk to somebody about it if you're having a hard time with it. Meet Claire, my baby. What is a growth spurt? Okay, so growth spurt happens to all babies, formula or breastfed, same with cluster feedings. A growth spurt is a rapid physical growth that lasts 2 to 4 days. When does this occur? I swear all the time. But there are some stages. There's like 9 days old, 3 weeks, 6 weeks. All the time, okay? It's all the time. And at this point, your baby's going to be a little fussy, nursing more vigorously, and restless. I think it's my jacket. Okay. And restless. I always choose to see this as a bonding experience and a way to increase my milk. Baby's going to be sucking more, baby's needing some more me time. So I choose to do that most of the time. Don't get discouraged. You do have enough milk, it's just that they need a lot at this point. Cluster feeding. Cluster feeding happens in the first month a lot. It's when your baby's learning to take in a greater volume at a longer interval. As baby grows, they become stronger and more efficient, which will lead to shorter, less frequent feeds. So, same thing. They're going to be a little fussy. They're going to want to eat more. You've got enough milk. It's just that they need a lot at this time. So keep feeding and keep encouraging that. Okay, so I want to talk about how breastfeeding can affect us mentally, because it can. And I don't tell you guys this to discourage you, I tell you to encourage you, and so you know what to expect. But you can become sleep deprived, which can affect anyone mentally. Breastfeeding can be very painful, which is discouraging at times. Poor nutrition, stress that you're not having enough milk, and difficulties with breastfeeding such as latch and growth spurts, stuff like that. So I think it's important to know that these are normal things to feel, and that there is support out there for you guys that can help you feel better, whether it's mentally or physically, about these things with, counselors or lactation consultants. And then the good news. Breastfeeding can really help you mentally as well. The prolactin hormone you secrete when you're breastfeeding is a calm, relaxation, lower stress hormone. Oxytocin decreases that postpartum bleeding, and it's the love and attach hormone that will help you bond with your baby. Others, there's self-esteem, confidence with being able to breastfeed. Mom feels empowered. You're going to burn 500 calories a day, so positive body image. And physically, you're at a lower risk for breast and uterine cancers when you breastfeed. When to start pumping. Okay, a lot of people get really overwhelmed with pumping. I suggest to always look up a YouTube on your specific pump. It helps a lot. And then just to take it easy. Start it out with just feeding your baby on one side and applying a pump to the other. There's no perfect way to start, but just continue trying and taking it slow, I think, helps. They recommend, again, to get started at that 4 to 6 weeks postpartum, so that breastfeeding is established. Go ahead and plan ahead with your employer so that you can plan ahead for work if you're going back to work. And then, I forgot to have you guys take this out, but in your swag bag, I have a magnet for you that goes over all the different guidelines for storing and thawing breast milk. And this just really helps, know what you can and cannot do. And then also some tips, like don't mix before feeding, do gently mix before feeding, don't shake your bottle, and so on and so forth. There's a few tips on there for you. So that's in your guys' swag bag. And then there's a how-to box, how to store milk on here on your workbook, and I have that you need to date it, amount in ounces, leave space for freezing, not spacing, it says spacing, guys, typo, sorry. Leave space for freezing, and then a lot of them, they can only store 2 ounces at a time because they'll feed and then they'll put it in a bag and go to store it, but you can actually, in a 24-hour period, store all the milk that you pump at that time or that you save in a milk saver. But you need to get it to the same cold temperature in a fridge. So even if that means you've got like 4 bottles in that 24-hour period in the fridge, they all have to be cold to save together. You can't put warm milk in cold milk because it will heat it up and kill the nutrients. So make sure before storing that you get it all to the same temperature cold. And then look over this magnet when you have a chance to look at like thawing and storing. Okay, solids. This goes for all babies, breastfed or bottle fed. The AAP and the World Health Organization recommends to actually start feeding solids at 6 to 8 months. This is a newer recommendation, and even with my baby 5 months ago, I was told that I need to start feeding her at 4 months. I know this isn't true. There's some things still being taken place until 6 months, and that is that you're protecting your baby's digestive tract still with coating their stomach, and then decreasing bacteria and viruses from entering their stomach. So the AAP and WHO, these are acronyms, recommend 6 to 8 months before introducing solids now. There's also ways to know if your baby's ready to do solids, and it's not just by age, but by sitting up, picking at foods that you're eating, moving their jaw and watching you eat. And then some foods that we can start, avocados, bananas. I always get really overwhelmed when I have to like add another meal because it's just another thing to prepare as a mom. But just take it easy and start with the easy foods and just have them on stock, and it will be less overwhelming for you. And then make sure that you're only doing one food at a time to identify any allergies when you're introducing foods. Maintaining supply. A lot of women want to know how they can maintain their supply throughout their postpartum or throughout their breastfeeding journey. Keep feeding your baby. And then demand and supply works with the baby creating that demand by sucking, and then in return you'll have the supply. So a lot of people think it's supply and demand, which is the normal saying. It's actually demand and supply. They have to demand it in order to get it. Some tips for maintaining supply: keeping hydrated, feeding more often, pumping more often, herbal options such as brewer's yeast and fennel, lactation cookies, and ingredients like oats, almonds, flaxseed, and feeding your baby at night to create the increase in prolactin. Proper nutrition. Okay, well, flourish to nurse. This is my favorite slide, you guys. You have to take care of yourself to take care of your family and your kids. And you've also got to be, so with this, you've got to be creating that proper nutrition and hydration. What is being taken out has to be put back in. Exercising. Every time you exercise, you detox. Obviously, wait until you're to that 6-week checkup, and your baby gives you, oh my gosh, your doctor gives you the okay. I didn't sleep a lot last night, okay? Prenatal vitamins and multivitamins. I didn't know that I needed to continue these after birth, but a lot is being taken out after birth as well, or during birth. You lose a lot of things, a lot of nutrients, a lot of blood. You've got to restore, you've got to replace. Making sure you're sleeping, of course. Sleeping is the foundation of everybody's health. And then time for you, which I have a little box here that I would like you guys to fill out at some point with 4 examples of things you love to do outside of being a mother. Because being a mother is my #1 thing too, but I'm also a human myself and a woman. And there's things I like to do for myself, like, I don't know, speak in front of 120 people about breastfeeding and postpartum. And that's why I'm here today. So make sure you're doing what you love to do and creating time for you. And then the global weaning age. I love learning about this because it's actually from 2.5 to 7 is globally when we wean our babies. So pretty interesting, right? Not so much here, but that is the global age. I think weaning should be a personal decision, not influenced by social or anyone else, but between you and your baby. The AAP recommends feeding until a year, breastfeeding until a year with the introductory of solids from 6 to 8 months. And the World Health Organization actually recommends breastfeeding until 2 years old. There's some signs that baby's ready to wean with getting distracted, less times at feeding, refusing breast often, and more interested in solids. My 11-month-old does some of these sometimes, but she's definitely still other days like on me all day, and I shouldn't even wear a shirt. But you can watch these, and if 4 of them are happening for a week duration, maybe your baby's starting to be ready, and they biologically and developmentally will wean when they're ready, or mom can wean when they're ready. Either option. How to wean. The best way to wean is dropping one feeding session for a 2-day duration, offering your baby formula, breast milk, pumped breast milk in place if they're under a year, or food if they're over a year or over 6 to 8 months, and then continue this pattern until breastfeeding ends. And then you can experience some breastfeeding or some mental health feelings after breastfeeding because you lose those hormones that we talked about, oxytocin and prolactin. These feelings make you feel relaxed and the less anxious, and when you lose those, you can start to feel a little off. This is just good for you guys to know so that when you do go to wean, you're ready to figure out what you're going to feel like and you know how to handle it. And what to do if you're dealing with this. I think it's really important to know you're not alone. Call your provider, reach out to our amazing licensed clinical social worker, Laura, and talk with family and friends. And there's a beautiful graphic here that just shows some things you can do if you're struggling with this. Focus on love, express your creativity, and talk about it. All right, and then I just would like to go over some of my favorite breastfeeding tips and things that I have benefited from knowing. I have to be dairy-free for both of my babies. This does not mean that any of you guys will be having this dilemma, but it's important to know that certain foods will disrupt your baby's, can disrupt your baby's belly and cause fussiness. So reflux can be happening with acid, and leafy greens can make your babies gassy, but it's always important to talk with a lactation consultant and your pediatrician about this before cutting anything out. But something to take a look at if your baby's 6 to 8 weeks and just constantly crying, because my daughter did for a really long time and I didn't know what to do. And then I was able to catch that my second time around a lot earlier. Making sure you're burping your baby. I have people tell me that their babies aren't good burpers, and I totally understand this, but keep trying. Get that gas bubble up so that they're not going to have pain later from it. Sitting your baby up for 10 to 15 minutes at a time to reduce the risk of reflux for them. Babies choking on supply, so you get this oversupply for a few weeks and they can't swallow it. So what you can do is the laid back nursing, so it's not going down their throat very fast. And then you can also stimulate your letdown before putting your baby on, so they're not getting that powerful letdown. Breastfeeding in public. Guess what, guys? In Utah, it is against the law for anyone to harass you about breastfeeding in public. Yes, this is amazing. If your baby needs to eat, feed your baby however you are, however comfortable you are with this. That's all I'm going to say on this. Plug ducts and mastitis. I have gotten mastitis 3 times, even as a lactation educator. I think some women are more prone to it, but it's important to be doing breast checks, even if you're not breastfeeding. Check those boobs when you're showering. Feel for any pain, and if you feel any, go ahead and rub it out. If you feel a lump, rub it out so that you don't get mastitis. Mastitis is when a plugged duct doesn't get resolved, and then it's also bacteria and virus is introduced to it. And it will hit you like a truck and make you sicker than you've ever been, and your husband has to come home from work early and it's a wreck, okay? So get the ducts unplugged and then you won't get mastitis, hopefully. And then I have a few resources for you guys on this page. This Latch Baby book is my most favorite book to recommend because it is 100 pages and it literally goes over most of the things I went over today. So it's super good for you to have during your breastfeeding journey, and it's very inexpensive. And then I'm Amazed Guide to Breastfeeding is the Breastfeeding Bible. If you want a longer read and want to know more about what's going on for you and your baby and breastfeeding, I would suggest this one. Also, there's some professionals. I can help you with education and support and confidence with breastfeeding. But I have Annalisa Birch of IBCLC, who's up back here, listed here, and she's got the ad in your book, and then Jill Lancaster. Both of these ladies are local to Utah County and can help you further. And then I'd like you to write down 5 family members and friends that can help you with your breastfeeding journey, even if that's me, because I'd love to help you. And then I want to share with you guys my favorite affirmation about breastfeeding, and maybe you could write your own. Mine is, my body knows how to feed my baby just like it did when I was pregnant. So with that being said, I want you all to know that your breastfeeding journey is a success no matter how long it lasts. And I hope that this makes you feel confident in however you choose to feed your baby through that first year. Thank you guys so much.
Enough to feed her baby each feeding. And so, do you know what kind of goes into why one woman would make so much more while another would make less?
You know, your hormones might be acting differently. You might be pumping and feeding more often than she is. And really it can depend on diet too, how much hydration you have, what you're choosing to eat, the food you're choosing to eat. And maybe her baby needs more milk than your baby too. Like some babies, my friend's chunky baby back there drinks as much, he's 3 months old and bigger than my 11-month-old and drinks more too. So it just really depends on the baby and the mom's situation, what hormones are going on and what you're eating. Anybody else?
So I don't know if you have any tips for like babies that bite you. Because that hurts, and I did not expect that, and I don't know what to do with it.
Does she have teeth?
Yeah.
Oh, okay. So it's time to let her know nicely that it's not okay. That's the best. Yeah, like you have to actually take them off and tell them, like, I know she's young, but continue to reinforce telling her, hey, this isn't okay, no. Or however you want to tell her no. Some people don't like using that word. But it's a really opportunity for you to establish some boundaries for you in breastfeeding at this time, even if it's early and they're young.
Can I get the name of the books one more time?
Yeah. So I'm Amazed Guide to Breastfeeding. Ina May's Guide to Breastfeeding, and then Latch Baby. Okay? She has another question to ask.
So I'm going to be returning back to work part-time at 4 weeks, and then full-time by 6 weeks after. So I know, like, it says in here a lot, like, introducing a bottle by 4 to 6 weeks, start pumping 4 to 6 weeks, but if I'm having to return before then, what would be your tips?
So that's why I kind of say, like, it just depends on your scenario if you have to start sooner. When did you say you plan to return back to work? So I would start about a week or maybe even 2 before that. And you could just start slow and easy, and then start having your baby go from that to taking 2 to 3 bottles a week so that they start knowing how to do this. And if you're going back at 4 weeks, you might even want to start doing this like at 2 weeks old.
Okay, one more question.
Okay, so you talked about mastitis and how some people are more prone to it than others. I have had it 9 times, and I am wondering what your opinions are on what makes people more prone than others.
Yes, and thank you for that question. Mastitis, I have to refer you actually to Annalisa. I can only kind of educate on that and not go too much into detail because it's an actual infection that's going on in your body, and I don't want to go out of my scope. But as far as kind of what can affect this is if you do have increased bacteria and viruses going from your baby's mouth to your nipple, and it kind of goes back and forth. But she would have some more ways to decrease mastitis and why it's continuing to happen for you. Thank you guys so much.